right, let's move to this now. The Gauteng Department of Health has reported new typhoid fever cases in the city of Tshwane. In a statement, the department noted that the new cases were lower when compared to cases found during the same period last year. Now, for a discussion on this, I'm joined by the Department of Health spokesperson, Foster Mohale. Foster, a very good evening to you. Thank you so much for your time. If you could just tell us more about the outbreak and the communities that it's affected.
Good evening to you, Masa, and good evening to your viewers at home, and thanks for this opportunity. Yes, as the Department of Health, we can confirm that according to the NICD, National Institute for Communicable Diseases, has detected a number of positive cases, laboratory-confirmed cases of typhoid, which is one of waterborne diseases, especially in the area of Tshwane district in Gauteng province, specifically around Hammanskraal and Bronkhorstspruit.
Now, Hammanskraal, as you've just mentioned, is also just recovering from a devastating cholera outbreak that claimed many lives. But in this typhoid case, the Department of Water and Sanitation has ruled out any link between the typhoid outbreak and the city's water supply. What gives them that kind of assurance?
Yeah, I think they might be correct. There are many possible sources or causes of typhoid. Water treatment plant could be one of those if there's contamination. But if they say so far there are any confirmed results to suggest that the contamination emanated from the water treatment plant, that's why the National Institute for Communicable Diseases officials, working closely with the health officials and municipal officials, they continue with the investigations, continue with what we call contact tracing and case finding. It's only through the outcomes or the findings of case findings that will be able to identify the possible sources of contamination. For example, look, the water which is flowing, especially in the communities next to Durbin's area, but also the issue of lack of proper sanitation could be one of those. So for now, our officials working with the NICDs, they are looking at the number of possible sources of this preventable waterborne disease.
Yeah, and I'm glad you mentioned that preventable and waterborne, because it does seem that there is a bit of a contradiction here if the city is saying and the Department of Water and Sanitation is saying their hands are pretty much clean when it comes to this because they've tested the water. But as you mentioned, it could come from sanitation, or poor sanitation, which also still falls under the Department of Water and Sanitation. But Foster, if we don't know where it came from and what caused this outbreak, how then do we prevent such?
Yeah, no. Remember, there are many contributing factors. That's why we always urge members of the public to maintain hygiene at all times, especially those who are responsible for cooking and serving the food handlers to say, and also anyone at home to say, when you go to a bathroom, when you come back from bathroom, wash your hands before you can touch other objects, before you can cook, before you can dish. And also, we understand that there are other areas where the issue of safe water might be a challenge, but hence we say at least use sanitizer in order to maintain hand hygiene at all times. So you remember that there are areas like your dumping, the dumping sites or along the sides where people dump a lot of things instead of proper dumping areas, where, look, that could be one of the possible sources. Hence, we want to appeal to members of the public to say anyone who exhibit or experience any typhoid-related symptoms, they need to present themselves to the nearest healthcare facility so that the doctors and the nurses can screen them, and if possible, they can be able to collect the stools for laboratory testing in order to identify, for example, through the case finding entails interviewing those who tested positive, try to establish their travel history, also the contacts, the people that they came into contact. So until such time that we're able to conduct the contact tracing and case finding, it might be difficult to find the cause. Because, for example, if I tested positive And when they interview me, I'm able to say I was in contact with Masa. We had the lunch together, or we went out together, and Masa also tested positive. And I work for Newzroom Afrika. Obviously, the Newzroom Afrika might be one of the possible sources that must be investigated.
Yeah, and you also mentioned if one feels the symptoms as well, they should go and get medical attention. If you could just also remind us of what those symptoms may be, and also I believe that they don't immediately present themselves. They may take some days.
Definitely, also it's very important to indicate that the symptoms of typhoid, they are not unique symptoms. They are symptoms which are similar to cholera and other conditions. But here we talk of common symptoms, vomiting, diarrhea, abdominal pains or stomach cramps, headache, fever, especially for those who are residing in the areas which are currently affected by typhoid disease. Of course, someone can experience abdominal pain or diarrhea because of what you ate yesterday, which your stomach or your body is rejecting. But we want to emphasize to those who are experiencing any of these symptoms, who are residing in the areas like Hammanskraal, Bronkhorstspruit, and other surrounding areas around Tshwane, to say, please, if you experience any of these symptoms, don't waste time. Just go to the nearest healthcare facilities. Our healthcare workers will be able to screen and test and collect stools if you are suspected. But also, we want to appeal to those who tested positive when they get interviewed by our healthcare workers during case finding or interviews, so that they need to be transparent, so that we'll be able to identify possible causes or sources of this preventable disease.
Foster, thank you so much for your time. Really appreciate it. That, of course, was Foster Mohale, who is the Gauteng Department of Health spokesperson. It's time now for a look at your sports news with Gwena Mabeno.